The medical interns are also protesting the new policy that will extend medical training from 5 to 6 years.
In my personal opinion, it's something that is targeted to make sure that they do away with the allowances of interns, because we know that medical students cannot be paid. And if we don't want to pay medical interns, then we make them students. However, it puts patients' lives at risk, because think about a student doing an operation on someone. These people do not have any legal or ethical accountability because they are still students.
The Federation of Uganda Medical Interns is now calling on Cabinet and Parliament to address their concerns.
We therefore like to make another more outcry to the Cabinet to consider this a matter of public interest.
Welcome back to the channel. Please watch up to the end, because today we are diving deep into an important issue: the growing crisis surrounding medical interns' allowances. This isn't just about pay. It's about fairness, healthcare quality, and the future of an already strained system. Let's break it down.
It is yet another year on the issue of medical interns' allowances has resurfaced. For years, the payment of allowances to medical interns has been a recurring concern, at times resulting in protests and strikes. This year, the medical interns are challenging a new government policy on their facilitation.
As we've just heard, this isn't a new problem. For years, medical interns in Uganda have faced uncertainty around their allowances, sometimes leading to protests and strikes. It's not new. Now in 2026, the issue has resurfaced again, and this time it's even more serious.
At the end of last month, government deployed 2,417 medical interns to health facilities across the country and were expected to report by August 3rd. But the deployment came amid concerns over changes in government policy regarding the payment of medical interns' allowances. A number of interns have reportedly not reported to their assigned facilities, citing uncertainty over whether they will receive any allowance.
Over 2,400 interns were deployed across the country, expected to report by August 3rd. But many didn't show up. Why? Because they simply don't know whether they will be paid at all. And that uncertainty is not just inconvenient, it is destabilizing.
You cannot expect to deploy someone without telling them how the allowances will be. You deploy them in remote areas. Imagine someone from maybe the central region is put in the deep areas of Kotido, and you're telling them, you go, you work, but you're not going to be facilitated. Your allowance, your accommodation, your feeding, we shall not facilitate any of that. We have found that it has destabilized interns and made them unable to report to their sites.
We are not against service. We have not refused to provide service to the citizens of Uganda. But we are just requesting for basic living standards. We are just requesting for allowance that can allow us to effectively perform our duties.
The government has, however, said the policy changes do not affect government-sponsored medical students, but the interns have rejected this position.
Let's be real here, ladies and gentlemen. These interns are being sent to remote areas, far away from home, with no guaranteed support for housing, food, or basic survival. And yet they are still expected to show up and serve. This isn't a refusal to work. It's a call for dignity. They have made it clear they want to serve Ugandans, but they need basic living standards to do so effectively.
Whether they are government-sponsored or privately sponsored, they say they all perform the same duties in health facilities.
It's not only malicious, but it is even unethical And that's why even the government, the so-called government-sponsored students, have also not supported it, and they have not been able to report their workstations. We do the same workload. We see the same patients. We do the same duties. It is simply unimaginable to say that you're going to pay one who has started on government and you not pay the one who started on private when they are delivering the same.
Another major concern is inequality. The government claims some interns will be supported, but only those who are government-sponsored. Now here's the problem. All interns do the same work, same patients, same hours, same responsibilities. So why should one be paid and another not? I'm glad that even fellow interns have rejected this policy, calling it unethical and unfair.
That one, we can say that it has been rejected across the board.
The medical interns say although they are often regarded as students, they have disputed this. They say they perform critical duties in health facilities, including working long hours and contributing significantly to patient care.
Medical interns are not students. We are fully graduated, for example, medical doctors, as I am, pharmacists, nurses, midwives. We do hold our academic transcripts and our degree certificates. We also have provisional practicing licenses from our respective councils, such as the Uganda Medical and Dental Practitioners Council. So for us to get the full practicing license, we have to undertake this 1 year of working under supervision by the senior consultants. Now that doesn't make us students. On top of them being able to execute almost 75%, actually 75% of the workload in our facilities.
There is also a dangerous misconception at play that medical interns are just students. That couldn't be further from the truth. These are fully qualified doctors, nurses, pharmacists, and midwives. They hold degrees. They have provisional licenses. And they are responsible for a massive portion of healthcare delivery, that is up to 75% of the workload in some facilities.
They also run long duties, a minimum of 36 hours, others 48 hours, non-stop. That leaves them with no option, no any other alternative of survival. And their only livelihood lies on this allowance that has been coming from the government.
We are talking about 36 to 48-hour shifts non-stop. No alternative income, no safety net. For many of these interns, the allowance is their only means of survival. Take that away, and you're not just affecting them, you're affecting the entire healthcare system.
In 2021, President Yoweri Museveni directed medical interns be paid an allowance of 2.5 million shillings per month, set at half the starting salary of a fully appointed medical officer. However, implementation of the directive has been inconsistent, with the Ministry of Health citing budget limitations. Last year, medical interns received 1 million shillings as their monthly allowance. The new policy that leaves them without any allowance has sparked concern, with the Federation of Uganda Medical Interns calling for the 2021 presidential directive to be implemented.
We further request that the 2.5 monthly allowance directed by His Excellency President be restored and paid free of any form of taxation, given how far short of a living wage it already falls. It is this that pushed the Medical Interns Committee to notify training sites in writing that interns will not be reporting to their stations until the concerns are resolved.
Back in 2021, there was a directive to pay interns 2.5 million shillings monthly, already just half of a full doctor's starting salary. But even that has been inconsistently implemented. Last year, they received only 1 million. Now, under the new policy, potentially nothing at all will be given to these interns. Ladies and gentlemen, that's not reform. That's a regression. Faced with this situation, interns have taken a stand, refusing to report to duty until their concerns are addressed. And while some may see this as disruptive, we need to ask, what happens when healthcare workers cannot afford to leave?
The Federation is also questioning the deployment of 2,417 interns, saying some medical interns were not deployed and calling on government to look into the matter. The interns also say the meeting with the Ministry of Health did not yield a solution to their concerns. Away from the issue of allowances, the medical interns are also protesting the new policy that will extend medical training from 5 to 6 years.
In my personal opinion, is something that is targeted to make sure that they do away with the allowances of interns, because we know that medical students cannot be paid. And if we don't want to pay medical interns, then we make them students. However, it puts patients' lives at risk, because think about a student doing an operation on someone. These people do not have any legal or ethical accountability.
The Federation is also questioning the deployment.
There is also a concern about a proposed policy extending medical training from 5 to 6 years. Some interns believe this is a strategy to avoid paying them by keeping them classified as students. But this raises serious risks. If you blur the line between student and practitioner, you risk patient safety and accountability.
The Federation of Uganda Medical Interns is now calling on Cabinet and Parliament to address their concerns.
We therefore like to make another more outcry to the Cabinet to consider this a matter of public interest and urgency.
The Federation of Uganda Medical Interns is now calling on government leaders to treat this as a matter of urgency and public interest. And honestly, they are right. This issue goes beyond Uganda. It's about how we value healthcare workers, especially those at the front line, doing the hardest work under the toughest conditions. If we fail to support them, we don't just fail the interns. We fail every patient who depends on them. If you have ever been to a hospital really sick, you want someone to take care of your sickness with immediate effect. You don't want people who are demotivated. You don't want people who are demoralized. You want doctors, whether they are senior doctors or they are just interns. You want one person working on you when they are really fully motivated. What the interns are asking here is not a hefty pay. It's not a pay raise. It's just an allowance to facilitate their stay at those medical centers for the whole year. I'm glad that supervision has been intensified. The ministers of local government, the ministers of health, when I watch the news, they are all over. They are holding the staff accountable. They are making sure that they are present at their workstations. That is a very good development. If we really support them by bringing in these medical interns, the work will be better. And trust me, the healthcare situation in our country will be better than it is now. So government, do whatever that is within your means to make sure that these medical interns are well facilitated. Let me know your thoughts in the comments. Do you think governments are doing enough to support healthcare workers? Don't forget to like, share, and subscribe for more deep dives like this.